Hello, my name is Justin Hess. I am a student physical therapist at the University of Central Florida. Right now we're going to go over cervical traction, mechanical cervical traction. First, some of the benefits of cervical traction would be to open up the joint spaces. You could use it to improve nutrition, healing, improving the vascular network, just the blood flow through the area. You could use it to offload nerve compression, and you can even use it to decrease the muscle spasm of the area. Some of the contraindications could include hypermobility, acute injury, inflammation, motion contraindications like a fracture, uncontrolled hypertension, and peripheralization of symptoms. Precautions can include cervical spinal disease, conditions affected by belt pressure such as pregnancy, displaced annular fragments, medial disc protrusion, claustrophobia, because you do have belts going around you in lumbar traction, not so much for cervical traction. Disorientation, severe pain, fully resolved with traction would indicate a nerve conduction block, inability to tolerate the supine or prone position, and lastly, TMJ issues and dentures in the case of cervical traction. In this particular example, our patient has a cervical muscle spasm from a whiplash injury 3 weeks ago. So we'll use cervical traction to minimize that cervical muscle spasm and guarding. What we want is about 11 to 15 pounds of traction force for a minimum of 20 minutes. It can be up to 30 minutes. And you want a 5-second hold and 5-second relax time. In this particular example, because her muscle spasming is in the splenius and upper tract area, we're going to go ahead and we'll create this larger flexion angle of the neck here. That way we can isolate those areas. If it was more in a cervical extension type position, then it would locate more of the upper cervical muscle area. So in this particular example, we have the rest against the mastoid process, and what we'll do is we're just going to tighten that up. And I want you to tell me when you feel it snug but comfortable.
Okay.
Right there?
Mm-hmm.
Okay. And a little trick you can do, you can just try to wiggle your finger behind the mastoid process just to make sure there's no space there. And I want you to try to see if you can wiggle your head side to side. I'll just tighten it up just a little bit more. This head straps is going to prevent the head from moving forward during the cervical traction process. You gotta connect it here to the rope. And then I'm going to give you this little call button. I want you to press that if at any point you feel any discomfort or pain. And then we can hit start. Alright, well now 20 minutes is over and the machine has stopped, so now what we'll do is we'll get her out. Here, I'll take this little button from you. And you are free to go. Perfect.
I think it's going the opposite way.
Ready, tidy, let's use.
Oh, I think you broke it. Wrong way.